Hello and welcome to the Dr. Suzette Glasner podcast. Don't forget to hit like and subscribe to my YouTube channel if you'd like to continue to learn from me. Today, we're going to be talking about Sober October. And in particular, I want to help those of you who have not yet committed to making a change to your health behaviors or your routine in the month of October. But it doesn't even just have to be about sobriety. It can be about reducing your alcohol use or your substance use. So it's not an all or nothing kind of thing. And we know that there are health benefits of making reductions to your alcohol or substance use if you don't feel ready to stop it altogether for 30 days. And I'm intentionally talking about this a little ways into October because I know there are some stragglers out there who have thought about making a change, but for various reasons decided against it. And what we're going to talk about today is 3 things that you might have thought to yourself that stood in your way or stopped you from moving forward. And I'm here to help you move forward and not let these thoughts stand in your way. The way that we're going to approach this is using techniques from cognitive behavioral therapy. And cognitive behavioral therapy, or what we also call CBT, is a type of psychotherapy. It's effective for all kinds of mental health. It's helpful for overcoming anxiety, depression, addiction. The reason for that is because a lot of our behaviors are tied to irrational thoughts. And irrational may sound like it's really bad, but we all have irrational thoughts going through our minds all the time. It has to do with ways that we're biased to thinking about ourselves and about the world, and it can influence the way that we see ourselves. It can influence the way that we see our own potential to change. And so let's just take a first example. One of the top thoughts that go through people's minds when they are contemplating making a change, like a Sober October or a 30-day challenge to change their health behaviors, is too hard. But I'm here to tell you, when it comes to changing your alcohol or substance use or any other health behavior, it's not too hard to attempt. Something that's implied by it's too hard is I'm afraid I'm not going to succeed. And we don't want to look at this as a black or white thing. Actually, for Sober October, studies have found that even when people reduce their alcohol or drug use, even if they don't stop it completely, so we call it more like a damp October, there are tangible health benefits of that. And they are measurable health benefits in terms of mood, concentration, sometimes weight, cholesterol. Those benefits, of course, are better if you stop altogether, but they still can be realized to a certain extent if you make an attempt and if you make a little bit of headway even. So stop thinking about it as all black and white is one thing I would say to it's too hard. But then a couple of other techniques you can draw from cognitive therapy is to ask yourself some questions to dispute or challenge that belief that it's too hard, because chances are it's not true based on your life history and your prior experience, but you're telling yourself that because you're afraid it's going to be too hard. So one question you can ask yourself is, have you ever tried it? Have you ever tried to cut back on your drinking or stop it altogether? And what happened? Was it a complete and total fail? Because if it was, that might be telling you something important about the extent to which you're dependent on alcohol. And if you're super dependent on alcohol, then you may just need more of a professional help approach, a therapist or an addiction expert to guide you through it. That doesn't mean that it's too hard. It just might mean that you haven't used the right tools. But if you can think back to a time when you've attempted this and it has actually gone pretty well, maybe to a point, and then you went back to old patterns, then you can reflect on that and say, actually, I've done it successfully before. It didn't last as long as I would have liked it to. And so I'm going to have to do something a little bit differently this time to make it last. But I at least want to try to achieve what I realized the last time. And that's good enough for a head start. The second thing you might ask yourself when you say it's too hard, and again, this could be about alcohol or about anything else, is have you ever succeeded at anything before in your life? Chances are you have. So take a moment to reflect on what difficult things you've taken on and taken on successfully. And what did you bring to those experiences that maybe you haven't brought yet to trying to change your alcohol or other substance use? A third way of approaching this is if indeed it really truly feels too hard. You say, Dr. Glasner, you keep telling me it's not too hard, but I've done it, I've tried it, and it was too hard and I couldn't do it. Okay, if that's the situation, then either you need professional help and or you need to break this down into smaller and more manageable steps. Maybe instead of drinking 4 drinks, you want to think about drinking 3 in a given situation. Or maybe your first step forward is going to be to monitor how much you drink so you can get a little bit of a starting starting point or a baseline and figure out what is possible and doable for you to go to from there. And if you're drinking heavily and constantly, you certainly would need to consult a professional. I wouldn't jump into a 30-day challenge or a sober October because you can go into alcohol withdrawal and that can be dangerous. So now we're going to talk about the second thought that people have that gets in their way of making healthy changes to their behavior. The second one is, I need it. I need to drink or smoke weed or vape or whatever it is that you do. I need it to unwind. I need it to relax. I need it to socialize. I can't talk to people if I'm not drinking. So the reality is you don't actually need to do it, but you have come to lean on alcohol or another substance to help you. And there's a difference. So the way that you talk back to that and address that is to really think about a sober October or dry January as an experiment. In CBT, we think about experiments. Everything's an experiment. We don't know what the outcome is going to be until we test it out and we try it. You want to think about some other ways that you can achieve this thing that you think you only can do with the help of weed or alcohol or whatever it is that you're trying to change. I can't sleep without it. Okay, let's do an experiment. Let's think about some other things you could do to help you sleep. I can't relax without it. Okay, let's think about some other things you can try to help you relax. And even if some of those things don't work, that's not a bad outcome. That means you just take that off the list. Okay, well, I tried meditating and it didn't work for me. Okay, next, what else might work for you? Maybe try a bath to relax before you go to bed, or maybe try exercising because that will help you get a little bit more tired. Also kind of release some stress, release some dopamine to give you a little bit more of that feel-good chemical that maybe you feel that you would be lacking if you weren't drinking or smoking weed or doing something else. Thinking about other ways to derive that pleasure or that effect that you're looking to get out of drinking or other substance use and really setting that up as an experiment. That's the best way to challenge the thought, I need it. So hopefully coming out the other side of that, you're going to learn, well, I feel like I need it, but there are some other substitutes and maybe they're not the same, but they might help me row in that direction of getting the same thing out of it that I was getting without all the negative effects. And that leads me to the third thought that might be going through your head, and that is drinking is no big deal and I don't need to stop. Why stop? That is one that needs a bit more unpacking. But if you're here and you're listening to this episode, there's something about drinking. There's something about another health behavior you're involved in that you don't like, or someone you love is involved in that seems not to be going so well. So this is more an issue of motivation. When you have that, I don't need to stop. It's fine. I could, of course, go on about a lot of education for you around the negative health effects of alcohol. We've learned that drinking causes cancer. I have a whole podcast episode devoted to that from recent research. It's definitely not harmless. I could tell you that, but more powerfully for you will be for you to examine what you have noticed and what you're worried about and what you're concerned about in regards to your drinking or other substance use. So to achieve that, make a list. What are the things that you like about drinking? What are the things that you don't like about drinking? How is it affecting you in ways that you don't like? There are some things that are bothering you about your drinking, enough so that you're considering doing a sober October. In that case, let's experiment with what happens when you drink less, or you try to drink less, or you stop drinking altogether for, I don't know, the few more weeks that are left of October. What happens? And then if you can journal and document that, I feel better in these ways, I feel worse in those ways, then you can have a better idea of what were you drinking alcohol for? What was it doing for you? Were you able to substitute in something else that could help you achieve the same effects? And what did you notice change for you in terms of your health, the way you were feeling physically and mentally? I will say that the studies on 30-day challenges to change one's alcohol use have shown quite a few health effects, ranging from improved sleep quality to feeling more in control over their alcohol or other substance use, better concentration, weight loss, and even some effects on liver functioning, even in just 30 days. So losing up to 40% of one's liver fat and lowered blood pressure and glucose. There are quite a few benefits that have been realized, documented, and studied from taking on these challenges, but you have to experience that for yourself in order to feel motivated by that. I can throw a lot of facts at you, but at the end of the day, it has to feel good to you to have achieved making a change like that and built some confidence in your ability to do that. And equally valuable would be if you learned that you couldn't do it on your own, because that would signal that you needed some professional help. And I have a lot of resources linked in the description and on my website, including my own books, the Addiction Recovery Skills Workbook, which is a 7-step guide to using cognitive behavioral behavioral therapy and other science-based exercises to change one's substance use, as well as my newer book, Addiction: What Everyone Needs to Know, which will help you just with a general understanding of what addiction is and how it affects the brain and body and what types of treatments we have available for substance use disorders or addictions, in case you're interested in going in that direction or learning more about that. So I hope you all end up either convincing yourselves or someone you care about to do something in Sober October, whether it's reducing your use of a substance or stopping it altogether if that's safe, or even changing another health behavior that would be meaningful for you. I look forward to seeing you next time.